Anna Jones. I am a FSCJ nursing student. I'm going to be demonstrating the insertion and irrigation of the nasogastric tube. First, I would do standard protocol. I would check the doctor's orders, and I'll compare it to the patient's MAR for the type of tube replaced and the tube purpose. And I would explain the procedure to the patient, which is just a tube going from your nose to your gastric contents. First, I would assess the patient's nares and oral cavity. So, I would just and then I would include one there and have them breathe in.
Okay, the patient is feeling gagging.
Then I would go ahead and measure the length of the tube from the tip of the nose around the ear to the xyloid process. And I would mark it on the tape.
The throat, can you please open your mouth for me? Okay, the tube is in, and the tube is in
I've
there,
already
and
marked
it's
my
oil,
tape.
looks good, and then keep on going.
Then I would
I need you
apply my clean gloves and wash my hands, or wash my hands and apply
and
clean
take a
gloves.
sip of water, and then every time you take a sip of water, I'm gonna advance the catheter in, okay? The tube in it.
I would lubricate
It's
the
in.
end 4 inches,
Advance, it's in.
and I would tell
In
the client
this
the
case, it won't
insertion
go
is about
all
to
the way
start.
in.
I
It's
would
just gonna pretend it's going all the way in. It's in.
And of course, I would apply the towel.
All the way in to 70 centimeters. All right, and now I'm going to tape it with temporary tape.
And then I would tell the client the
Across his
insertion is about
face.
to begin.
This is all
And
good.
I would
And
make
now
sure
I'm
that the
going
bed
to
was
check.
up high, of course,
I'm
and
going
then
to
in
aspirate.
flowers. And I would have the patient lay back, and I would begin the
The stomach
insertion.
content.
I would take my pen light and make sure the NG tube is not coiled in the back of the throat, and it's not. So now I'll have the patient go chin to chest and keep inserting it.
No, just restart. Pull it out, we'll record it. You don't know how to send it?
If it's too long.
Upload it to
Keep
email.
inserting it until I reach my measurement mark. Then I would temporarily attach it. To the patient's nose. And I would ask them to speak to make sure that's okay. And then I would take my syringe, and of course if any gagging or coughing occurs, I would tell the patient to let me know, and I would stop it and allow the client to rest. So then I will check the placement. I will pull back and get my secretions. If I get 15 milliliters, then I'll make sure to put back 15 milliliters. So I would also check the pH too. So then I would listen. And I heard a gurgling, so I verified the placement, but a true placement verification would be with a chest x-ray. So I would then detach it. I would anchor the tube to the nose. And I would apply a rubber band. With a safety pin, I would anchor it to the patient's gown. Then I would attach the NG tubes to the suction source. And I would state my insertion documentation, which is the type of the NG tube I inserted, the length, the size, and the color of the drainage that I took out, and the pH levels. Okay, then I would irrigate my NG tube. Okay, so of course I would come in, reassess the patient, make sure he's okay, and then I would verify. And I would implement standard protocol, and I would position the patient in the same half-hours position, and I would wash my hands and apply my gloves again. And I would disconnect my NG tube from my suction source, and then I would check the placement of the NG tube again. So I have a pre-filled 30 milliliter syringe. over the left gastric. Push it in and listen for gurgling and swishing sounds. Okay, and I heard it. So then I would make sure to withdraw a full 30 milliliters, my normal filling. And I would restart it. And then I would reconnect to the suction source and it would be either low or intermittent. Then I would state my irrigation documentation. The difference in volume, the irrigation results, and I would monitor the patient. And I'll make sure the patient didn't have to use the bathroom. I'll lower their bed back down and
looking good, and then I'll
monitor them
patient's room.
and the client's response to the procedure.
Hi, my name is Riza, and I'll be